Hey everyone, it's Lindsay. This week we are talking about infrastructure and health, particularly what happens when health isn't a priority, when there are other sort of pressing needs and things that are going on in countries and communities that are bigger than health, right? We often think of health as a fundamental sort of thing, but this week we're gonna talk about that. Again, just a reminder about the first step of your policy paper is your annotated bibliography assignment. There's more detailed assignment instructions on Canvas, so you can look at that. It includes an example of an annotated bibliography so you can see what they look like. You're gonna be looking for a total of 15 sources. 10 need to be scholarly in nature. The other 5 can be popular press, other sorts of things. Some of the issues that we're looking at have more cutting edge sort of stuff. And so there's not a ton of scholarly sort of stuff. So you can look through those. Annotations should be about 3 to 5 sentences. Mainly what I'm looking for is, like what was the sort of overall impact of this paper that you're looking at, who were sort of the people involved, what were the outcomes, those sort of things. So 3 to 5 sentences. And from there, you'll be able to narrow things down as we work through the assignment. So this week we were talking about technology. I have some pictures here. All of these pictures are my pictures that I've taken while working, well, not all, one of them is not, while working abroad. The one in the top left is a woman with a cell phone. This is from one of my very first trips to Africa. I was in Nigeria. I was working in a health clinic, and I thought it tickled me that we're in this health clinic. It's a free health clinic where people were coming just for sort of basic healthcare services. And this is when camera phones were first on the scene. I didn't even have a camera phone, and this woman was taking a picture of us. And so I just thought it was kind of an ironic sort of thing when we're looking at technology where people don't have the very sort of basic healthcare needs, but they had access to cell phones with cameras in them. And so there's been a whole lot of developments about sort of micro technologies such as cell phones and other sort of things that have really moved us ahead that we didn't see in some of the more developed world. The picture on the top right is discarded medical equipment. One of the things that the West often does is donate used medical equipment that we no longer want or no longer works. And they think, hey, well, you know who wants it? Poor people. So let's just go send them a whole bunch of poor, broken ass stuff. And so what you see are these sort of technology graveyards and medical equipment graveyards all over the developing world, where good intentioned people were trying to donate something, but they didn't donate anything of use, and then it clutters up. When we talk about environmental sort of impact later in the semester, we'll get back to that. The picture on the bottom left is from the Gambia. This was at their main teaching hospital in the country. This is in the capital. Their X-ray technology machine had broken. And so the doctors there would do the x-rays, and then they would have to hang them out to dry and look at them just sort of in the sunlight, which again was one of those sort of things of like, this is the main hospital in the entire country, and they're getting their chest x-rays done. They're hanging out in public, no kind of HIPAA privacy here, and just sort of these very impactful sort of moments in my traveling sort of life. Finally, the one on the bottom right corner is from a trip to Nigeria again, where they were doing operations. If you look closely, you'll see there's 2 people in the same operating theater because of lack of infrastructure. They didn't have sterile sort of spaces to do all these sort of things. So the use of antibiotics and other sort of biomedical technologies are really big there because infection risk and other sort of things are pretty big. They're doing the best that they can with universal precautions, but still you can see from that sort of room, that's a full operating room where they're opening people up for hernia surgeries and C-sections and other sort of things. So some questions to ponder this week as we kind of go through this is to think about, can technology compensate for the lack of infrastructure and differing socio-cultural norms about insurance, healthcare, preventative care, these sort of things? Does technology hold the answers for all these sort of things, right? Oftentimes now our biggest sort of rush to everything is like, well, we'll find some technology and that'll fix everything. But does it fix everything? And what does that mean in sort of the grand scape of things? The video that you watched for your readings this week about designing alternative solutions for least developed countries, although novel and really cool, what does that mean in terms of the messages it sends to people in developing countries about the standard of care that they receive? In the US, would we be okay with some piecemeal sort of thing put together? No, probably not. A lot of the things that happen in the developing world, we would be totally appalled at. And we're like, yeah, no way would we accept that. But we think other countries should be able to accept that. Yes, the alternative is, well, if they don't have that, what are they going to have? Which is a good question, but when we have these two sort of systems, we know that it creates this separate but equal sort of footing of, well, in the developed world, we get good care, and in the developing world, you should just take what you can get. And what kind of inherent racism and classism and all those sort of things are ingrained in those sort of thoughts of people should just be grateful for what they get. Now, two of the articles that you read this week talked about health insurance. We know here in the US, the health insurance industry is huge and vast and complicated and all these sort of things. Well, these articles were from the beginning of the 2000s that were talking a lot about how do we increase health insurance, and this sort of technological advance is going to be the thing that really helps Africa. If we can get everybody into health insurance schemes, and then we'll be able to solve all of the continent's problems, right? Much like Medicare for all and all the other sort of things here, we know that just providing access doesn't guarantee anything. And so if you look at the health insurance fund, it's now called the Farm Access Foundation, and they've updated some of their stuff. Again, these articles are a little bit older. And this infographic on the left side is their 2019 impacts, their latest sort of numbers of what it is that they have. You know, they're talking about, like, they've enrolled 11.8 million people into their healthcare programs. Like, wow, that seems like a lot of people, right? And they talk about their different programs in Ghana and Kenya and Nigeria and Tanzania. One thing that I really like to do, and that I think is really important to do with numbers, is we always have to contextualize them, right? And so we see this 11.8 million, that sounds like a really big number. We see these 4 countries. Okay, what does that actually mean? Well, what we need to look at is what are the populations of these countries, right? So the population of Ghana is about 30.42 million. Okay, the population of Kenya is estimated at 52.57 million. The population of Nigeria, which is actually the most populous country on the continent, is 201 million, and the population of Tanzania is 58.01 million. So altogether, all of these 4 countries have a total population of 342 million, slightly larger than the United States in total. So when we look at that 11.8 million number out of 342 million people, well, now that number doesn't look so impressive. In fact, if we actually looked at the raw percentages, less than 0.03% of people are invested into the Farm Access Foundation healthcare insurance, right? Less than 0.5%. And so while those numbers look great for the 11.8 million people who have them, in terms of total population, that's a really small drop in the bucket. One of the other things they like to talk about is sort of how the affordability of it and these other sort of things. They in a different article talk about their average annual costs. So their annual premium for their programs are about 34 euros, which translates to about $40.98 US dollars. Co-payment, if they go to a doctor care, is about 25%. The average sort of cost of a visit, that translates out to about $7.23 per visit. In the United States, we know that people on average go to the doctor 2.78 visits per year. So while we don't have good numbers on all of these sort of things because the company doesn't provide them for us, if we just use those sort of running numbers based on US standards, this is what we can kind of break down. Average patient cost per year for health insurance is $61.08, right? For us, we're like, $61, that sounds amazing. But then again, we have to adjust it for per capita income. So in Ghana, per capita income is $1,700 per year, and they're spending about 3.6% of their income on health care. lower. In Kenya, they have a little bit of higher per capita income, and so they're spending a little less, 2.9% of their income. Nigeria has a little bit even higher per capita income, so they're spending 2.8% of their income. Tanzania has less development and is a little bit more dealing with poverty, and so their per capita income is only $930 a year, so about 6.6% of their income. Again, we think these are pretty small sort of things, but let's kind of do a comparator. In the US, our average per capita income is $54,200, so substantially more than in all these 4 countries, but we're spending about 13 to 20% of our income on healthcare costs. 13% is the sort of average healthy person, and 20% is the less healthy sort of average person. And so in comparison, we spend a lot more of our income on our healthcare than these countries, and yet the uptake in their health insurance has been really, really low. We'll hold on to that and we'll come back. So the Investment Fund for Health in Africa used to publish really great numbers, but now not so much. And so these numbers are the last ones that I have available, which are from their 2014 Investors Report that you can no longer even find. I have it saved from a previous sort of class, but you can look at some of the data that I pulled out there. Again, we look at sort of the combined total population versus the percentage of people enrolled. This one, even less impressive, 0.0016% of people who are invested in the Investment Fund for Health in Africa, right? So between these two programs, we don't even have 0.5% of people invested in health insurance. So some questions sort of to ponder. These programs started in the early 2000s. It's been over a decade of growth. Are these successful or not? Right? Our first sort of look is looking at that raw percentage of like less than 0.5% of people are enrolled in these programs. That doesn't seem super impressive, right? But when we translate it to these raw numbers, when we're talking about millions of people, for them, sure, I would guess they would probably say it's successful. They continue to be engaged in these sort of things. And so a lot of times we have to look at these sort of things from various perspectives. In the US, we tend to just give it a black or white kind of look. But when we talk about success, is it successful in the grand scheme of big picture? Not really, right? But is it a successful thing for the people who are able to invest in it and are able to take part in these sort of things? If you read the company's sort of reports and other sort of things, yeah, they think it's done some really cool stuff in these countries. And so it's one of those sort of perspectives we have to really look at and say, how are we judging these sort of things? How do we judge success? How do we judge a lot of different things? Do we take sort of stock in small victories? I tend to think that way, right? So based on this sort of stuff, what do you think the chances are of a paradigm shift happening? What do you think the idea is that everybody across Africa and across the developing world is going to be like, yes, insurance is a really awesome thing and we should totally do that? Well, since they've only grown to less than 0.5% over a decade, I would guess that is probably not something that's going to happen soon or ever. So why do you think this is? Why do you think that people are like, yeah, I'm not going to do insurance? And even if it is only a small portion of their income, why do they say, no, this is not something that I want to do? Well, one thing is we have to go back and kind of look at our public health history, right? The idea of preventative care versus sort of treatment for health. We know that in 1948, the World Health Organization redefined health as not being just the absence of disease, but a complete state of physical, mental, and social well-being. And we know that is something that we still struggle with here in the United States. This might have been the first shift away to say like, hey, just not being sick doesn't mean that you're well. But there's also a whole bunch of other sort of things to do. We know that in the US, we still struggle with a lot of preventative care stuff, right? If we look at healthcare expenditures, we know here in the US, we spend the majority of the money in treatment models and at the end of life sort of care. And so we're not even really good at it. So how do we expect other people who have less insurance, less access, less levels of education, who might not have as much of a focus on preventative care, why do we expect them to all of a sudden be like, yes, I'm totally going to take care of my health and do these insurance sort of things? One of the things that we can look at in this paradigm is looking at Maslow's hierarchy of needs. Hopefully you've seen this before. Pretty fundamental to public health is looking at how do people take care of their selves and their needs. And when people are thinking about sort of health insurance, that's not something that usually ranks on the low end of the scale of the hierarchy of needs, right? Yes, we need air, food, water, health, but health and health insurance are, as we know, completely different sort of things. And so for a lot of people, yeah, health insurance is something that, like, yeah, if it was a priority in my life, it was something I could afford, if it was something that was even on the top of my list of concerns, maybe I would do that, right? But for the most part, for many people, that's not a real sort of issue. So for this week, the thrust of what I want you to do this week is to watch a BBC documentary. It's called Inside Nigeria's Kidnapping Crisis. I have spent a lot of years in Nigeria. I have a lot of passion and experience there. And this documentary is really important. It speaks to me, and I think it's a very good representation of sort of daily life in Nigeria, what it's like. The cool thing about this video is that it also has a high focus sort of on technology, and this is a really great documentary that talks about where technology and daily life intersect. This documentary is not specifically about health, but I want you to watch this video and then think about what we talked about this week with health insurance, with hierarchy of needs. And for your discussion board this week, for your class activity this week, I just want you to write about that. Think about what we talked about last week when we talked about sort of the thought experiment of what would we give up for health insurance and these sort of things. And then imagine yourself being in Nigeria in this sort of midst of daily chaos, and think through those sort of things. So mostly you're just going to be watching a video this week and then reflecting upon that. I've put up the websites for both of the health insurance companies, so you can kind of look over those and see what is new, what is updated from the readings that you had. And if you have any questions, feel free to shoot them to me. All right, thanks. Bye.